It's time for Pet Files Ask the Vet, underwritten by the Millerton Veterinary Practice, traditional small animal medicine and surgery, chiropractic, laser therapy, acupuncture, and Chinese herbal medicine. 518-789-3440, millertonvet.com. With us today, founder of Millerton Veterinary Practice, Dr. Carolyn Cannon. Hello, Dr. Cannon.
Hello, Jill.
And this is Sarah in Portland, Maine. We'll see if the streak continues. I had to rush my cat Juno to the vet last week because she suddenly wasn't able to walk. Her front paws were curled under and she could only kind of crawl. The vet said the muscles around Juno's spine were not functioning and said he thought Juno might have toxoplasmosis from eating a mouse. He gave her antibiotics. In all the panic, I really couldn't absorb what I was being told. Juno has never eaten a mouse in her life. That was last week. Now her front paws are less curled under, but she still doesn't really want to walk. I'm in watch and wait mode, but I don't feel well informed. Can you please explain what toxoplasmosis has to do with walking, and how could a cat get it if she didn't eat a mouse?
So toxoplasmosis is a disease that, it's a parasite, basically caused by a parasite. It's a disease caused by a parasite called Toxoplasma gondii. And the toxoplasmosis can affect actually most mammals. The interesting thing about the cat is that cats are a necessary part of the life cycle of toxoplasmosis. So it's a kind of a complicated life cycle. And even though the cat is part of the life cycle, they most often don't get affected by it at all. So it is actually unusual for cats to show signs of toxoplasmosis, but it does happen in cats and dogs. We see it very occasionally. I suspect it, especially with neurologic symptoms. So I think that this walking is presumed to be a neurologic problem, that the nerves to the muscles aren't working. And so sometimes we'll get brain problems, too, with seizures and animals who aren't normal in between seizures and suspect toxoplasmosis. So there should be some tests run, definitely. And I don't believe that we know how old Juno is. So a couple things. But raw meat, mice definitely are a source of toxoplasmosis. Most cats don't get it unless there are some immunocompromised, but it's possible that Juno, if Juno has never eaten a mouse, has gotten it through the mother's milk, because it can pass that way as well, or through the placenta and the milk. And has been dormant, and so now she or he is showing some signs. The antibiotics, if started, early, typically you will get some good response. Clindamycin usually is used to treat toxoplasmosis, and but as I say, it's usually a kitten thing or an immunosuppressed cat. So definitely your kitty should be tested for feline leukemia and feline immunodeficiency virus. So hopefully that was done. If not, that should be done. And run the course of clindamycin and just keep checking in and making sure that she's doing better and that your vet is following things along, and that she should be tested. There's an IgM test. Immunoglobulin is the IG part, and the immunoglobulin G means that they've been exposed, and IgM is more commonly associated with active disease, and then that is an initial titer, and then when she's doing better, we do a second, 2 or 3 weeks down the road, do a second blood draw and compare those IgM titers to see if we're actually increasing. If that's the case, then you have your diagnosis. Plus, you have a cat who's getting better.
Which is obviously the point of the exercise. All right. So it's not just, okay, so it's not just toxoplasmosis. In other words, there's stuff that she could have.
Yes, it's unusual for cats to have symptoms of toxoplasmosis. So that's the key there is why did she get it? Does she actually have it? Because she's not a hunter. If she's 12 years old and has never been exposed to a mouse, or raw meat at all, then it is certainly possible she got it from in utero from the mother, but it's less likely. So first we need to sort of monitor whether we have the right diagnosis.
Right.
But I think the question was, how does it relate to
it?
to walking. It sounds like there's some neurologic problem going on and can be many, many things. So hopefully there's some testing being done.
All righty. Chris and Liza in Ancramdale. Okay, this is weird, I know. But I love questions that start that way. But we're having a bat problem over here, as in they're finding a way into our upstairs windows all the time lately. Thing is, we have 3 very curious and active Maine Coon cats ranging in age from 3 to 7 years. Other than rabies, do bats pose a danger to the kitties?
So I really never learned a lot about bats in veterinary school, but because I read, I do know that bats can carry lots and lots of viruses. Of course, it's it's a thing now because of coronavirus, a thing that people are super interested in. But bats, as a species, can carry many, many viruses. I believe most of them are RNA in nature, and they can cross species. However, in reality, there aren't recognized diseases that are seen in clinical practice that dogs and cats get that are suspected to come from bats, except for rabies. So rabies is the big one that we're worried about. But if your pet is up to date on rabies vaccination, then it shouldn't be a very worrisome issue. And I don't want anyone to go around doing anything bad to bats because they are really important for the ecosystem. With pest control, eating. I read somewhere that they ate enough of the pests that influence agriculture that they save billions and billions of dollars on pesticides.
Yeah, no, they're amazing. Not to mention the fact that in the other world, bats represent rebirth. So I'm going to endorse. We're not doing anything bad to bats here, and
they pollinate. They dispense seeds. They do all kinds of wonderful things.
Yeah.
And they're really pretty cute.
I was just going to say they're pretty kind of cute looking when you start looking at their little bat.
Yes, and they are. People are worried. There are all kinds of weird tales about bats because they're out at nighttime, I think, and they're spooky.
Yeah.
But really, they're not going to run into you. They have really good
radar
echolocation devices, and even if they fly close to your head, they're not looking to bump into you at all.
Right. They're not swoopy. They're not. It's not the birds. And I'm just going to say that usually when they find their way in or find their way onto a window to have a quick sleep, you will return at dusk and so forth, and they will have gone off. So it's really.
Yeah, and so I guess the big thing to be concerned about is if you find a dead bat in your house and your animals are around.
Are standing there with a little sign saying, "We did this."
You need to make sure that they're up to date on their rabies vaccine, and then also call your own doctor to make sure that, which is to find out if they want you to have the bat tested.
Right. Well, I will say this: I'm still recovering from an affluenza story at a camp where. There was a bat in the dorm room. Nothing. Like way big, high ceiling, big. But they sent. They sent all the kids home.
Oh goodness. Well, I have come home. We came home once with babysitters here, and there was a bit. Everyone was in one room because there was a bat loose in the house. It is no fun to have this fluttering thing that's now trapped inside and terrified.
Right. But you could open a door. Never mind. I'm moving on to the next question. And I'm glad you guys got home when you did, because I'm sure that the bat was, at least had a better chance than with.
Well, they were all, they all had their bike helmets on, so they were locked in the room, and the bat was in the rest of the house, and they all had their bike helmets on and hats and covering their hair and all that stuff. But yeah, they're easy to catch. They can be easy to catch. Once they get tired, they flop on the floor, and you cover them with a blanket and pick them up and put them outside unless they look ill or may have bitten someone, and then you need to save them and potentially send it in for rabies testing.
Right. All right. Now we're moving on to Fort Wayne, Indiana. We are just all over here. Can you please tell us what you know about the dog virus in Michigan? I live in Indiana, so it's only a matter of time. Mainly, I want to know how to protect my dog. I trust you more than I trust the news. Thank you, Alex, in Fort Wayne.
Thank you for that. They're having a Parvovirus outbreak. I think many people have heard of Parvovirus. The confusing part was, or initially, they weren't sure what was causing these poor dogs to die. Dogs who are unvaccinated and have never been exposed even a little bit to Parvovirus are in serious danger of dying from parvo. Dogs who are well vaccinated almost never have that severe of an illness. So it causes a really severe diarrhea. But I'm sorry, I didn't finish my sentence. What is confusing about it is that many of the dogs initially were coming back negative on the test that is, we call it an in-house test, meaning we can do the test right at the clinic. And that particular test was coming back negative at the clinics, but when the samples were sent to the lab, coming back positive finally, so we knew what it was. So I don't know what the disconnect is there, or if this is a different strain of some kind, perhaps, but it is Parvovirus. It is very contagious through feces, and it is a serious disease, and vaccine works quite well to protect dogs against Parvovirus. So it is a, exposure through feces, which, dogs have their noses everywhere.
Yep, and I'm now going to go into civilian mode as I am wont, as is my wont, and just way back when with the original shark. So that's 50 years ago, just about 45. That was the first parvo outbreak that I knew about, and it was in the city, and so basically you had to be super conscientious about where you went and what they were sniffing and who they were sniffing. And you stayed out of dog parks, and
that was before the vaccine.
Yep.
And you should explain to people that shark was a dog.
As opposed
shark,
to
I don't know anything about sharks getting parvovirus.
No, that's shark. Anyway, right? Okay. Shark is a dog. Shark is a dog. Shark is a dog, and Shark was originally named so that I could take my dog to the beach, and that is the story, and that is true.
I see. Okay. So, there is no specific treatment for this virus, so it's lots of supportive care, and it means, hospitalization, even if they're vaccinated sometimes, hospitalization. But mostly it can be treated they can be treated in an outpatient way if they're well vaccinated, and oftentimes they won't get it at all. But supportive care. So intravenous fluids, that my first experience in veterinary medicine was the initial parvovirus outbreak. And boy, that first week, we had several dogs with, really, really sick with diarrhea, bloody diarrhea.
Yeah.
In a very small kennel. And I knew that I could do that without vomiting, then I knew that this was the work for me.
Yeah, and you did it. And you have so many satisfied customers, it just defies credulity. So that's really good. Can you manage the bloody? Can you manage the bloody diarrhea and stuff at home, or is it just sort of?
Well, the problem really is the amount of fluid loss that happens so suddenly, and so it's replacement fluids if they're very, very ill, and this is why the dogs die.
Yeah,
is because they are,
they get easily dehydrated. So the long short is, if you have, and this is another one of those, you catch it early, you're much better. So if your dog is bumbling around and then suddenly is a little like and poopy, go to the vet. That's all I'm going to say.
Yeah, and the virus severely suppresses the white blood cell count as well. So, and the white cells are used up and trying to, attack the virus, and so it's an absolute disaster. The best thing to do is to be well vaccinated and or once they're vaccinated, run the parvo titers. So if there's a parvovirus outbreak, or if you're thinking about traveling with your dogs to that part of Michigan, then you want to make darn sure that they're well protected with antibodies.
And did you do the dogs? Are they regularly vaccinated for parvo?
So it's included in the every 3 years distemper adenovirus parvo vaccine. But I do more titers, and so what I can tell you is that dogs who are have been vaccinated young tend to hold most dogs tend to hold a very nice high antibody level that's protective for many years. Occasionally, I'll get a dog with a low titer, but much more common to have a lower distemper titer than parvo.
Right. I know someone who had
a titer being an antibody level,
and a titer being a way of testing before vaccinating. Because if your antibody level, I mean, again, civilian version, if you've got sufficient antibodies, you don't need an extra vaccine for it.
Correct.
That's it. Okay, Chadney in Great Barrington. My teenage son has been taking our dog Petey to run alongside him while he rides his bike. He insists that Petey loves it, but I'm not so sure.
Oh, boy.
Yep. We always have one of those, sort of King Solomon questions. Here we go. How long can a dog run for before it's too much strain? Petey's a 5-year-old Weimaraner Hound mix.
So there's so much going on here. So, number one, pavement on the paws for miles and miles. Most people have to ride their bikes on something pretty solid. So it's either pavement or, a really packed dirt road with stones on it. So running on that for miles at a time would be problematic for pads, usually. Maybe he's riding on the road and the dog's running on the grass, but I can tell you that dogs can be distracted by so many things, and they will run right in front of the bike. And if they don't run in front of the bike, then they might run behind the bike and pull it over. So that's a really scary thing, and so many people are badly injured, and their dogs are injured from those kinds of accidents. So that right there is a reason not to do it. Dogs can run. If you're riding a horse and your dog's coming along off leash and you're out in the woods, dogs can run for miles if they're in good shape. Especially a hound or a Weimaraner, they can run for, if you're walking 5 miles, they're usually doing about 8, running back and forth to you.
Right.
The question is, it's theoretically a great way to exercise your dog, but a dangerous way.
I'm sorry. I'm just weighing in. Totally understand it. And the question's very good. The question is fine because the question is how long can you do it? But that's actually not the problem. It's not the length of time that you're out with the dog. It's what's happening. It's the surface, and it's the potential for way worse for both teenage son and Petey. So that's.
Yes, and heat exhaustion, you know.
Oh, and everything. There are about 20 other things that you can come up with that aren't under the rubric of how long can a hound run? It's like, how blue is the sky? So, Petey, teenage son, that's your answer, Dr. Cannon. All right.
Yeah, I say no more.
Right. It's now you're going to have to weave those threads together and see what you come up with. All right, Matthew in Germantown. Captain, our 2-year-old Great Pyrenees, has been diagnosed with Wobbler syndrome. We're wondering about maybe acupuncture. Do you know the success rate of alternative treatments? And do you have any opinions for acupuncture in particular for this? Our usual vet is pretty old-fashioned.
So first I'll explain Wobbler syndrome. Typically occurs in large breed dogs, and it is the cervical vertebrae are the ones that are in the neck, and it's called cervical vertebral instability. So for whatever reason, or nobody's really sure, it probably has to do with genetics and the formation of the vertebrae. There is instability in the spine. And, of course, a lot of these dogs have great big heads, too, which may be difficult for them to carry, difficult for the cervical vertebrae to carry because all the muscles are attached to them. So for whatever reason, we haven't completely nailed it down, but what happens is that there is some compression of the spinal cord, and the compression, first off, causes weakness and wobbliness. Ataxia is the word in the back legs. The reason that it first affects the back legs is that the nerve tracks that run to the brain from the back legs run on the outside. So they're the first ones affected by a compression. Usually, oftentimes it's disc compression or scar tissue compression of the spinal cord, and so the nerves don't work well. If it goes on long enough, then it gets into the deeper tracts, and then you have the front legs that are affected as well. Typically, this is diagnosed when the back end wobbles. It unfortunately can happen in really young dogs. This is a 2-year-old Great Pyrenees. I had an adopted Great Dane. We adopted him at 18 months, and I started to see symptoms at about 2 years old, or about the same. And I caught it really early. The first thing I saw was he tripped one back foot, did a little funny thing on the stairs, and I said, "Uh-oh." And you know, I've treated dogs with acupuncture. We have to be very careful with rehabilitation therapy and chiropractic, but I have treated them with acupuncture, and it is a nice palliative therapy for the pain and so forth, but it doesn't get to the root of the problem, and is not going to, it would be lifelong and probably not keep your dog comfortable enough. So my suggestion is, if you're going to a veterinarian who's old-fashioned, is to get an appointment with a veterinary neurologist who's also a neurosurgeon, and get, if you can afford to do it, get an MRI or a CT, whichever they recommend, so that you can see the areas of the cord that are being affected and see if surgery is going to be an option. And I can tell you my anecdotal outcome with my own dog. He had 3 areas of compression. I had them do surgery on the worst area, and from there, and that was successful, and from there he did, I did acupuncture and all kinds of interesting care on him, and he lived to be almost 9 and died of heart disease.
Yeah.
So, I think what you need to do is, these great big dogs, is get to the root of the problem, and that is typically surgical.
And, and I happen to remember that whole thing, and including he went down the stairs, and I bet he's got such and such. And that was the beginning, but you ended up meeting some good people along the way as well, plus having your very own acupuncture patient to work on.
Right, and he was not a good patient. He was afraid. He was afraid of so many things, but he did cooperate.
Was he as bad a patient as Diesel was?
I think that he was a little worse because he's so big. Was so big, and he wasn't happy about having his toenails clipped and all those things. I didn't have him as a puppy, so it was a bit different. But yes. So he was probably one of my worst patients, but he did really well. He was no longer allowed to jump up. What he liked to do was shake toys. So we would have to take his toys away if he started to shake them outdoors, and my husband would throw it up in the tree, and we caught him jumping to try to reach the toy out of the tree. So he wasn't allowed to do that, and he wasn't allowed to play tug at all. But otherwise was walked quite a bit, and they can have a good life, with the right care.
Well, I can endorse and confirm that he had a superior life. This has been Pet Files. What I should say is, so thank you very much, Dr. Cannon, and this has been Pet Files Ask the Vet, underwritten by the Millerton Veterinary Practice, 518-789-3440, millertonvet.com.
Thank you for having me.